Hey everybody, welcome back to the IndeVets Happy Hour. I am your host, Andrew Heller, DVM. I'm here with my co-host, as usual, Marisa Brunetti, VMD. There you go.
It's the same thing.
Yeah, today we have a really fun, exciting clinical topic. We are going to be talking about how to get our pets to vomit.
Intentionally.
Dogs, cats, there are some differences, and there's a really cool new product on the market which we're gonna talk about. It's called Clever. It's FDA approved as an emetic in dogs, and we'll talk about other emetics in cats as well. But we're hoping that veterinary professionals in small animal practice listen to this one, because this is a cool new drug. Definitely something that I can't wait to get my hands on out there.
Well, hopefully you won't need to use it a lot. However,
yes.
Why? I think it's so interesting because I'm wondering, do they have these same things in humans? Because why do we need an FDA-approved emetic in dogs?
Because you can't use your digital method in dogs.
You can't stick your finger down your dog's throat. Well, you could try, but please don't. What's the worst thing that you've seen a dog eat, foreign-wise?
Underwear?
Yeah, I have had that, and then I had a lab who ate two pairs of socks. They were each was rolled into its own ball, intact. They came out intact in the pair.
Yeah, I mean, I've seen fish hooks.
You made them throw up?
No, we didn't make them throw up. I'm
Okay.
just thinking of things that dogs have eaten, dumb things that dogs have eaten.
Obviously, we need emetics in dogs to hopefully make them vomit up things that are appropriate, that are foreign, that they shouldn't have eaten.
But there are some instances when we're not supposed to do that.
I think this is the most important point, and something I always struggled with as a new vet, which is what should I not bring back up? Just to reiterate, there are a few instances when you don't want to induce emesis, and that's if the dog has eaten or ingested a hydrocarbon or petroleum distillate, which those are things like gas, kerosene, tiki torch oil, which I don't know why any animal would eat that stuff.
Why would they eat?
Yeah, but please don't bring that back up.
Since it's written, it means that it's been
Exactly.
It's been ingested in the
Exactly.
back.
Another instance is if the material has sharp edges, and in which case don't bring that back up. Consider endoscopic or surgical removal, or feeding a bulk high fiber diet if it's a small piece with sharp edges. Thirdly, if the substance is corrosive or caustic, and then you should dilute the substances with water, milk, or magnesium hydroxide and provide support like pain meds if they need it.
What about batteries?
Batteries. I can never keep this straight. So I think that this is a great question. So thank you, Andrew. Alkaline batteries, if they're intact, and you're going to need a radiograph to prove this. If they're intact, it's safe to induce emesis.
Wait, what's an alkaline battery?
That's your normal,
just like a regular,
yeah,
like AA, AAA?
Mm-hmm.
Okay.
Yep, but there are some lithium AA, AAAs, so you have to be careful. They say it on the package.
Okay.
If alkaline batteries are ingested and they're intact, you can induce emesis. It's safe. However, if the dog ate a lithium or disc battery, or the alkaline battery is punctured, they should be removed immediately via scope or surgery. Then you have those tiny little watch batteries, which, sometimes people call them button batteries. If those are in the esophagus, you need to remove them immediately. But if they're in the stomach and beyond, depending on how many there are, you can consider feeding a bulky meal to help make the passage. And then, so those are the four main things when not to induce emesis. And then some other reasons not to, which we all know, is if your patient has an underlying medical condition, that should stop you from doing that, like severe LARPAR, brachycephalic dogs, megaesophagus dogs. And then obviously if the patient isn't mentally appropriate and can't protect its airway.
So a lot of people call me on the weekends, my friends.
Yes.
And they're always asking me, my dog ate this, my dog ate that, what should I do? And, I jump right to call poison control, number one, just to make sure that we have that process started. Because even if they have to end up going to the emergency room, at least we have a case number that the emergency doctor can call. And then usually I'm telling them, grab some hydrogen peroxide. Yeah. But I know there's some things that people have asked me, hey, should I give them salt And I'm just like, why would you give them salt?
Right.
So there are other things that people can sometimes use at home as well that we want to tell you not to.
Yes. Yeah. So, we're humans and we like to try things that are inappropriate.
Salt.
Salt. Liquid soap. Don't use it to make your dog vomit. Ipecac, which I don't even think they make anymore. Salt. Don't use that. Don't stick your finger down your dog's throat. That can be very dangerous. Mustard powder. Absolutely don't use that. And then lastly, something we think about really frequently in dogs, which is 3% hydrogen peroxide. Like, don't use it in your cat. And that's basically because we all know cats have very sensitive esophaguses.
Yeah. Usually you don't find out that a cat ate something they shouldn't until they're like obstructed and they're in surgery.
Exactly.
You find a wad of hair rubber bands that
Exactly.
they've been eating and keeping in their stomach for weeks.
Exactly. So yeah, but don't use hydrogen peroxide in cats just for a higher incidence of esophagitis.
All right. Well, then what should we use in cats?
That's $1 million question. Why doesn't someone come up with an emetic for cats? There is none. And so unfortunately, you can't use our most trusted emetic, apomorphine, in cats like you can in dogs because cats lack the receptor for apomorphine. So in cats, people usually use something like xylazine or dexmedetomidine, whatever they have available, or you can try hydromorphone, and all of these things, given IM, have the potential to cause a cat to vomit. Maybe.
Yeah.
Possibly.
Well, that's good to know. It's definitely a good refresher for anybody who hasn't induced vomiting in cats in a long time.
Yeah.
Xylazine, if you have it, dexmedetomidine, if you usually should have that. And so in dogs, I've always used apomorphine.
Yeah.
In the emergency room, they have it injectable, but in general practices I've been in, they usually have the little pill that you put inside the eye, in the eyelid.
Yes, and now they make a compounded injectable apomorphine, so a lot of the practices I've seen are now switching to that, which is great.
So much better.
It's so much better because that little pill in the eye,
It does work well, though.
It works, but like getting it in, and I saw a lot of irritation with it, and so the injectable worked so great.
Well, we'll be talking about Clever, this new drug, and that's also administered in the eye as a drop. So drop is definitely better, I think, than a pill in the eye, which I can't even imagine how that must feel.
Imagine putting a pill in your own eye. I just can't.
It's terrible.
Yeah.
It's terrible. So I'm excited to talk about this drug. I think it's definitely a game changer.
I hope so,
something that we can rely on.
Yeah.
So let's talk about Clever. There's this new drug on the market. I don't even think it's really hit many practices. We are in so many different practices as indie vets. I haven't seen it. Have you seen it in any of the practices?
I haven't seen it yet, but it's definitely, the distributors have it. It's ready to go. I think people are ready to buy it. So
it goes by the name Clever. I think Vetiquinol is the one that is selling it now.
Yep.
The actual generic name is Ropinirole.
Yep, Ropinirole ophthalmic solution. So it is a drop in the eye, which is great. It is 30 mg per ml. And the way that it works, I had never heard of Ropinirole before, but the way that it works is it is a full dopamine agonist, and specifically to the D2-like receptor. And obviously, this drug binds to these receptors in the trigger zone, in the chemoreceptor trigger zone, which then transmits the information to the vomiting center to trigger vomiting.
So they've done a bunch of tests. I read some of the testing that they had done, but they didn't test it in puppies under 4.5 months. So this is really, at this point,
labeled for dogs older than 4.5 months of age and weighing more than 4 pounds.
And it's pretty effective. 95% effective at making dogs vomit within 30 minutes.
Yeah. And what did you say, 80?
So 86% of the dogs in one of the studies vomited before 20 minutes.
That's great.
And the median time was 10 minutes. The quickest was 3 minutes.
Wow. That's crazy.
Yeah.
I think two other important things about this is it's mainly eliminated via the hepatic system. So we obviously have to take caution in dogs with liver impairment. It hasn't been tested in dogs with liver impairment, so just keep that in mind. And then it is very sensitive to light. And so each little dropper comes in an aluminum pouch, and you have to keep it in that original package, even if you're like waiting for the dog to vomit before you possibly give a second dose. You have to keep it at room temperature in the original packaging.
And the dosing is different for different sized dogs, obviously. I believe it was 3.75 milligrams per meter squared.
Yeah, and instead of, for us veterinarians who don't want to do meters squared,
Unless you're an oncologist. And you're an oncologist, you might understand that.
Correct. But when I see that, I'm like, what? Anyway, there's a handy chart in the drug insert. So make sure you keep the insert when you get the box. But there's a chart about how, based on the size and the weight of the dog, how many drops to give. So like, for example, the smallest dose is 1 drop. That's dogs up to 11 pounds. And then larger dogs, like real large dogs, like 130 to 220 pounds, get 8 drops.
That's a lot of drops.
It's a lot of drops.
Yeah, in the eye. What I read was that you have to actually do 2 drops in each eye to get, and then wait 2 more minutes and do the other 4. So it actually takes a little bit longer in those big dogs. Yeah. But it must work. Because they were part of the study as well.
Yeah. And so going by, what we talked about with the storage, it's stored at room temperature, which is also great because APO that's compounded is usually in the refrigerator and has probably a shorter shelf life than these in their original packaging. But what I think is really important is that, you have to wear gloves and protective eyewear when you're handling it.
And don't do it if you're pregnant.
Correct.
Or lactating.
Yeah. Or intending to become pregnant, apparently. Yeah. Or I guess that means you're actively trying, I guess. So I think there are more precautions that our nursing staff and our assistant staff have to take into consideration with this.
Right.
Because not only do they have to wear PPE for it, but after you administer the first dose, you have to put the dropper back into the aluminum pouch to protect it, right? Like don't just put it on the counter or the treatment table, which I would probably do. And then you actually can give a second dose after 20 minutes if the first one doesn't produce vomiting. And then the other issue is, disposal. Obviously in vet med, we're all about, controlling costs. But if you have a very small dog and you only have to use 1 drop out of this, you can't save the rest of the dropper once you open it. So after 30 minutes, you have to dispose of the pouch and the dropper no matter what.
All right. So what are the contraindications then? Because I know they only studied this in healthy dogs.
Yes. So couple contraindications, which I think are the same contraindications for any emetic use in dogs, right? Especially ones in the eye, which is, central nervous system depression, seizures. Obviously, don't use it in all those times that we talked about earlier about when not to induce vomiting. And then if there's eye problems already, so if there's already a corneal ulceration, there's ocular irritation or injury, you obviously don't want to put this on top of that.
Ooh, I wonder, and this is probably something we have to look up, but I wonder if a dog has glaucoma.
That wasn't specifically mentioned.
It wasn't mentioned, but I wonder.
If it's controlled glaucoma, I'm sure it's fine. But I'm guessing.
I might go with the injectable APO.
Yeah, I wouldn't put it in an actively But then my question is, do you have to check an IOP? Yeah, I probably would. If it was high, I probably wouldn't put it in that eye. I'd put it in the other eye if that eye was fine.
Good point.
Yeah.
All 8 drops.
Yeah, all 8 drops. Anyway, so yes, there are obviously some precautions when using this drug. You're right. They did it only in healthy dogs. And so it hasn't been evaluated in dogs with cardiac disease or cardiovascular compromise, hepatic impairment, like I mentioned before, dogs less than 4 pounds, dogs younger than 4.5 months of age, and pregnant, lactating, and breeding dogs.
Okay, well then what are some of the side effects that you might see?
Yeah, so obviously when we give APO, we notice some mild sedation sometimes. And with this drug, you can get transient tachycardia and decreased systolic blood pressure, and then salivation, muscle tremors, abdominal discomfort, lethargy, and then, of course, the eye irritation, which I feel like I always saw with the little tablets of APO in the eye.
Yeah. So if they keep vomiting, when I administer APO, I usually give them an injection of Cerenia.
Right.
Maybe for the rest of the day so that, we've got everything out. Now we want them to be comfortable the rest of the day. Would I still give Cerenia if there's protracted vomiting?
Based on the drug insert, to stop protracted vomiting with this drug, they want you to give metoclopramide since it's a dopamine antagonist.
That's a good point.
Yeah, at a dose of 0.5 mg per kg IV or sub-Q.
Pharmacology 101.
Let's go back to that.
Think back to
Let's go back to that.
all the different mechanisms there. Yeah, that's great. So we talked about precautions for humans administering the drug. What about pricing for practitioners? What are they pricing this thing at? So
I looked up a bunch of distributors. The good news is all the distributors at the current time are charging the same thing. And the cost to client hospitals is about $110 for 5 doses. So it comes in a box of 5. Each dose is individually wrapped, so you don't lose anything. And so that's about $22 a dose at cost. And so if you mark it up 2.5%, it's $55 a treatment.
That's not bad.
No, I think, and it would probably be marked up further because of the time it takes, especially if you're working on a big dog and you have to wait to put all those drops in, and then you have to wait for the dog to puke.
We used to charge so much money in the ER
Sure.
for inducing vomiting, and I could never understand why.
It
takes so much time. You're right. There's a veterinary
nurse.
technician sitting there with that dog until they puke. And now $22 your cost just to administer it.
Right.
That's a lot of money.
It is. But
it's worth it.
It's absolutely worth it. And I was thinking about all the veterinary nurses and how important they are in the induction of vomiting for these things. And I was thinking about my nurses back in the day and some cool stuff that they used to do. And so I was wondering, have you seen anything cool? Like, how do the nurses prepare these dogs for vomiting, and like any tricks that you've seen?
Well, I'm thinking back. They always put those diaper pads down, and a lot of times they just like hug them and they're like petting their head and they're trying to get them to just relax, because they usually start lip smacking. And they just, they're just so loving. Actually, that's all I remember is that.
Yeah, it's such a tough job. My technicians were so amazing. They would get a big black trash bag and they would cut a hole in it, and then they would put it over the dog.
Oh.
So like it would be covered.
I haven't seen that. That's a
right.
good one.
And this goes with charcoal administration too, right?
Yeah.
They would puke and then they would give them charcoal, and so they cut a hole in the black trash bag, put it over them, but then they would also put a trash bag over a large litter pan. And so the dog would puke directly into the litter pan, and then I could search through it for stuff.
Yeah.
And then when you're done, all you do is like pull the bag up, throw it out.
Done. Easy.
Yeah. Very thankful to all of you veterinary nurses out there for your supportive care.
Well, thank you, Marisa, for joining me today. This is a great topic. I learned a lot from you. I learned a lot actually just researching this new drug. It just reminded me about all the things like the dopamine agonists and just the whole process. So this was great. Hopefully our audience learned something. If you're just tuning in for the first time and you haven't heard any of our other podcasts, we've actually recorded 9 others. So go back and check them out on any of the podcast platforms out there and leave us a positive review, or write to us and tell us if there's something specific you want us to talk about, and have a happy hour on.
Thank you, Andrew, for having me, obviously, in my own living room.
In your own house. I brought the beer today, though.
Thank you for having me with a beer at noon on a Friday. Cheers. But no, really, I'm excited for this new product. Obviously, as vets, we're continual learners. We have to keep abreast of all the new drugs, procedures, and techniques. Sometimes it's hard to read everything with all this content out there. I know I feel overwhelmed, and so I'm hoping on your drive to work today, you learned a little bit about a new drug that you may see in practice, and hopefully it makes you feel a little bit more comfortable using it.
And one thing else, we are not sponsored by Vetiquinol or Clever
or Guinness
or any of the things that we talk
Island
about here.
beers.
We do this out of the kindness of our hearts and just because it's fun.
Thanks, Andrew.
We'll check in later. Bye-bye.
Cheers.
Cheers.